I think I'm starting, then Bill. How do I get?
Think we should be live.
Left to right.
Mute.
All right, Madam Speaker, to you.
Okay. All right. Good afternoon, everyone. Can you hear me?
Great.
Okay. Along with my co-chair, Senate President Bill Ferguson, I would like to call this meeting to order. Before we adjourn session, the Senate President and I created this committee to respond to the growing uncertainty at the federal level. And since we've adjourned, federal funding cuts have continued. New lawsuits have been filed, and a massive budget is under debate in Congress. The complexities surrounding these actions are wide-ranging, and their impacts on our constituents seem to change daily. But despite these unprecedented actions, we can all agree that Marylanders deserve some certainty. They deserve to know how these recent federal issues will impact them and their families. So we need to stay informed and ready so that when the legislature reconvenes, there will be no surprises. Because as many of you may know, I don't like surprises. Today, we will first be briefed by the governor's office and our Department of Legislative Services on the current landscape of the federal budget and reconciliation process. Then we will be briefed by the Attorney General on the different lawsuits he has brought in response to actions at the federal level. I know we all have been eager to receive this analysis. I am confident everyone on this call believes that responsible governance, not chaos, is what will protect our state. And that work is exactly what this committee will begin to do today. I will now turn it over to my co-chair and my good friend, Senate President Bill Ferguson.
Thank you, Madam Speaker. As always, a pleasure to be with you. And thank you to each and every one of the members who is joining us here today. I know that each of you has been actively engaged within your communities, responding to the great deal of uncertainty that's happened since we have left session. And certainly there has each day brought a new question or series of questions about what is Maryland's impact from the actions that we are seeing at the federal level. I will have some more remarks at the end, but want to make sure that we have plenty of time to jump into things and have time for questions. As the speaker mentioned, we will break into three different sections today, three different presentations. We will have about 15 minutes of presentation for each of those sections, and then we will open it up to questions after each one. We are aiming for about 30 minutes for each, so please note, members, to try to limit your questions to things that are specific. Certainly we want engagement, but we want to make sure that it is purposeful and that we are not, and that we are using everyone's time as wisely as possible. We will cut it off at some point so that we make sure that we have plenty of time to hear from all three of our different presentation panels and that there are plenty of time for questions for members. So without further ado, Madam Speaker, if we are ready, let's go ahead and welcome our first presenter, who is Matthew Verghese, the Director and Senior Advisor for the Governor's Federal Relations Office. Mr. Verghese, do we have you available? If we could highlight Mr. Verghese, there we go. And do we have a presentation or are we going to go directly?
Mr. President, I'm pulling up my presentation right now. Just give me a quick second.
Excellent.
And of course, this worked right before everyone joined the call, and of course, it is slow now. So hopefully, it will come up quickly.
105-degree heat will do that to the joys of technology these days. Do we know if the DLS staff have a copy of the presentation by any chance?
I'm not aware.
I believe we are expecting to get a copy after the presentation.
Afterwards, okay. Mr. Verghese, your video is choppy. I'm wondering whether we have lost internet bandwidth here.
Mr. President, sometimes it helps if we aren't all on, visibly just listening. Sometimes that helps with the bandwidth.
It should come up with the presentation. We should have sufficient on this one. Let's see. Oh, he is re-entering. Maybe that is. Let's see if this will do it. Best laid plans. All right, Mr. Verghese, I see that you have entered separately.
I'm going to try and do this one more time, Mr. President, and hopefully
All right.
this will work.
Excellent.
Oh, excellent.
Here we go. And if you could just make it full screen, and then it is all yours.
Great. Thank you, Mr. President, Madam Speaker. It is good to be with both of you and this committee as I provide this update on what is happening in Washington, D.C. Things are changing by the minute. For the members who don't know me, my name is Matthew Verghese. I'm the Governor's Director of Federal Relations and a Senior Advisor. Some of you may know me in previous hats I've worn, including being the former Chief of Staff to our current Attorney General. So it's good to be in good company as in a very critical moment for a lot of policy decisions that are happening in Congress. I know my time is relatively short, so what I'm going to try to do is go through a lot of information in my 15 minutes, focusing on reconciliation and then kind of ending talking about our other threats to federal funding. And of course, what we also care about is the annual appropriations for the federal government moving forward. A quick primer just on reconciliation, what it is. I know there's a lot of words on the screen, and I'll make sure that this presentation is made available to all the members after I finish. Reconciliation is really just a way for Congress to bypass the filibuster. And so when you have majorities in both the House and the Senate and the White House, it allows you to essentially govern unilaterally without having to compromise or work with the other side. In the president's first term, that's how he got his first tax cut package done. And of course, under President Biden, that is how we passed both the American Rescue Plan as well as the Inflation Reduction Act. So both sides do this. And so this is something we expected if Republicans were essentially victorious in November. Where we know things are right now is that the House passed what we will call the One Big Beautiful Bill, the OBBB. And of course, the theme of that bill is not only extending the tax cuts, but essentially cost shifting a lot of programs back to the states. The Senate is now considering it right at this moment. We have text for a number of their committees, but we have not seen the final text of what the Senate will be voting on. They're going through a rules process right now, what we call the bird bath. The Senate has rules in terms of what is eligible for this fast track simple majority procedure. And the person who decides what is in and out of that bill is a Senate parliamentarian. And so she is going through and making recommendations right now on what provisions Republicans want to include, but may not pass muster with the rules. They are hoping to get a final determination for the parliamentarian by the end of this week and vote this weekend. The goal was to have this bill done. The goal being the president's goal was to have this bill done by July 4th. And so the Senate is going to try to do that. The question is what happens after the Senate acts. Will the House just vote on what the Senate does? Will they essentially just be forced to take it? Or will they be some type of back and forth or conference process between both chambers? The Speaker Johnson indicated that he is likely not going to go to conference and essentially put the Senate package on the House floor to try and get this done as quickly as possible. If you ask me, July 4th is an arbitrary date. And really, I think the date that they have to act is when they have to raise the debt ceiling. The debt ceiling is included in this bill, and that date is likely in mid-August. So really, the runway for Republicans is much longer. The biggest impact on reconciliation that we will talk about is Medicaid. The House passed bill likely is the biggest change to Medicaid since the program's inception, with a number of impacts to the state. Freezing state provider taxes, limiting state directed payments, impacting the federal match, what portion of the feds will pay of this by 10% for all states that provide care for undocumented individuals, adding more stricter work requirements, adding more eligibility checks for who can be in the program, and then of course penalizing hospitals who provide gender affirming care like what we provide here in Maryland. In many ways, we thought the Senate would be better on Medicaid and turned out to be worse. And their text that they have proposed is even stricter, even more strict requirements on state provider taxes and state directed payments, making more eligibility requirements on who can get Medicaid, and of course, treating the difference between expansion states like Maryland and non-expansion states differently, again, hurting states like ours. These provisions are currently going through the rule process I just spoke about before, so we don't know the final text, but we know clearly that the Senate is going to have a much more severe impact. All of you know this, Medicaid in Maryland is incredibly important, 1.5 million people, and is the largest source of federal funding to the state. So any change to Medicaid, whether it's administrative costs or how we pay for the Medicaid program, will have a major impact on the state and the state finances. The Maryland Department of Health put out some numbers based on the House provisions. So of course the Senate provisions are worse, but this will give you a kind of a good benchmark for what we're looking at. Work requirements will potentially impact 56,000 Marylanders, potentially cost the state $300 million, as well as additional administrative costs. Eligibility checks is potentially 130,000 people who will lose coverage, and of course, nearly $900 million in lost federal funds. State directed payments, $175 million in lost federal funds. If the changes in taxes could impact the state to the tune of $2 billion. And of course, if we choose to continue to provide care for undocumented families, that has a potential impact of $400 million in less federal funds based on the reduction to our FMAP. So money really across the board. I would not total all these numbers up to figure out what the impact of the state will be. Some of it will be double counted, but clearly we're looking at potentially hundreds of millions of dollars in lost federal funds, more administrative costs if these Medicaid changes go forward. As if that wasn't bad enough, the other big provision that the House did was make states now pay more for SNAP, and basing that on our states, the cost share for our SNAP program, which right now is 100% paid by the feds, to be some portion that states will be paying. And they're basing that on our essentially the error rate in terms of both underpayments and overpayments in the SNAP program. When we came into office in FY22, the error rate at the end of the Hogan years was 35%. We have improved that in the last year, cutting it almost in half. So now it's 19%. But that means that under the House bill, we'll be paying 25% of the SNAP program under the House provision. What does that mean for us? It is potentially hundreds of millions of dollars. What the Senate has done a little bit in terms of making it a little better is that if they essentially reduce the cost share from 25 to 15%, we'll see exactly where the last provisions will go in the end. What we know is that the SNAP changes will also be talking about the error rate, that how it's calculated, and of course, adding additional work requirements, just like they did with the Medicaid program. And the impact to Maryland, regardless of whether it's the House bill or the Senate proposal, is that we are in the highest bracket. And our Department of Human Services estimates that the House framework, so that's a 25% cost share, would create essentially a $500 million additional burden on Maryland taxpayers to administer the program as currently envisioned. We do know that additionally, there's administrative costs to do the work requirements and eligibility checks. And we know those work requirements will likely lead to more people essentially losing their SNAP benefits. The other side, of course, on the bill, I'm going to spend a whole lot of time here, is a lot of tax cuts, more tax cuts than the president did initially, talking about state and local, corporate, a higher standard deduction, a higher child tax credit. Some of this will be net positive, including no taxes on tips and overtime pay, but it is a huge tax package. The Senate does things a little differently. They try to limit some of the new tax credits and, of course, give additional environmental tax credits that were phased out in the House bill. They extend that in the Senate package. And they, of course, make a lot of business tax credits permanent. The impact to Maryland clearly on the tax front is, because we are connected to the feds and people who use the standard deduction on one form take the standard deduction on the other. Some of these changes will mean that less people will itemize. And then, of course, the big impact is that because now you will be required to have a Social Security number to get your tax credits, we expect that our immigrant population, including our undocumented population that do pay taxes right now, may essentially opt to not pay taxes completely. Not only they will lose access to those credits, but we will lose access to the revenue that they currently contribute to the state budget. Most of these tax revisions will go into effect January 1st of next year, but some of them will be retroactive for this current tax year. We know that since these are the current federal tax brackets, most Marylanders won't see a huge change to what they're paying, but there will be some short-term benefits for some middle-class working Marylanders from the child tax credit, from SALT, and from no taxes on overtime and tips. What we know right here, based on the Institute on Taxation and Economic Policy, the average tax change for someone, let's say in the second 20%, will be about $800 a year, while the top 1% will probably see a savings of about $66,000. The average change for most people will be about $3,000 total from the House provisions. Other impacts in reconciliation that we are tracking, of course, includes an impact to our higher ed facilities and our institutions who will now have a risk-sharing policy on student loans. And then, of course, the gutting of the Inflation Reduction Act. So all the clean energy tax credits that could potentially early sunset, the transferability of those credits between private and public entities, and then, of course, the repeal of all the EV credits that we have been using for that transition. Then, of course, there are money that Maryland has won from the Inflation Reduction Act, including our Clean Ports program, climate pollution reduction grants that have gone to state agencies, solar for all, so that households can add solar to their homes. They are essentially clawing back all the unobligated funding. So even money that was awarded to Maryland, they are clawing back. And of course, the Senate is still dealing with a lot of outstanding questions. What happens to Medicaid? What happens to SALT? What happens to the senators who want even more cuts to government funding? I'll gloss over this. I think we all know the House bill, the analysis is that it is tilted towards the wealthy. The people who will be paying for it are people at the bottom end of the income spectrum, and the people who are netting the biggest benefit for it are people at the very, very top. And that's when you look at all the impacts, the changes to SNAP, the changes to Medicaid, and then the risk to students and families. Really, what is happening, the bottom is paying for tax cuts for the very, very top. The other threats to federal funding is, of course, what the Trump administration tried to do in its first month in office, which is essentially freeze federal grants, even money that we were awarded and we were already expending. The Attorney General and his team will talk about this. We have been very successful in court, and essentially I'm pushing back on this. But clearly, we are closely monitoring grant cancellations that we're receiving on almost a daily basis from the federal government. Some of the things that we are tracking includes more than $201 million cut when it comes to opioids. And we got a cut from SAMHSA and CDC, $98 million terminated for our education entities, losing money for digital equity, and of course, losing money that we were expecting to modernize our unemployment system. And of course, the Attorney General will talk about a case that he joined just this week where they are challenging some of these DOGE cuts as being illegal. And then, of course, the other aspect of this is that not only are they canceling grants, they're saying if you take federal money, you are compelled to now follow the president's directive, whether it's on immigration or a number of other or anti-environment, DEI. And so, of course, the Attorney General has joined a successful suit that we have on injunction that was essentially imperiling all of our DOT money. So we'll see where that case goes. But of course, now we are facing a similar situation with money we get from DHS and FEMA. And then, of course, we know the big impact here for the DHS is what happens to sanctuary jurisdictions. They put out a list. The president has an executive order that says that money cannot go to those entities. And we will see where that happens at the end of the day. I was just at MML. Clearly, if there's an impact to jurisdictions that are considered sanctuary, even though there's no federal definition for that term, we will have a high risk. That list is inaccurate. There's an existing preliminary injunction against that list, but clearly this is something Trump tried in his first term, and he's going to try to do this again. The other thing that we're tracking at the federal level is what OMB is trying to do in terms of illegally blocking money that's been appropriated by Congress from reaching the states. They're doing this both through a package of rescissions that the House voted on, but also through what you will hear, I think, likely more in the coming months, impoundment, essentially saying that even though Congress has appropriated X billions of dollars for a program, they just will not release that money. We're already seeing that happen right now, where money is not flowing as we expect it to flow, even in formula programs from EPA, from NASA, from the Department of the Interior. And so we know this will be likely a future area that we will have to litigate with the president. The last thing I'll talk on before I turn it over for questions is, of course, appropriations. We are near the end of the fiscal year. We're on a continuing resolution, and so we're looking at what happens after September. Does the government shut down? What type of funding package will be approved by Congress? The president has really not submitted his proposal. He released a skinny budget that tries to cut 20% of non-defense domestic programs. And then, of course, he released a 1,200-page appendix that provided a little bit more information about what he wants to cut. The good thing about the president's budget is that Congress doesn't even have to consider it. It's essentially a guide for Republican lawmakers, but clearly is a signal of his priorities and what he wants to do. I cannot understate this enough, is that we are so behind when it comes to the appropriations process in Congress. They have not passed even one bill through either the floor of the House or the floor of the Senate. And it's clear that we are quickly approaching September without a bipartisan deal to keep the government open. And then, of course, what is the potential impacts to Maryland if the president's budget did become law? That's cuts to education, that's cuts to clean and drinking water money, cuts to state opioid response grants, the possible closure of NASA Goddard, and then, of course, less job training programs across the state. It's also less money for home building, state rental assistance, Job Corps, and of course, potentially Head Start, which we thought could have been cut, but was not included in one of these cuts. But clearly, the president does not care for a lot of these programs that we are very reliant on and have used successfully here in the state. The other piece of this is like where are we in the appropriations process is that the House is trying to move this forward. But remember, this cannot be done with a simple majority in the Senate. You need a bipartisan deal for this type of work. And so, of course, this back and forth between the Senate and the House, Senate Democrats is really the bulwark we have to prevent some of these cuts, but clearly is a very dangerous time. The country has never operated on two continuing resolutions, one fiscal year after the other. So we will see what happens in September. We all remember the longest government shutdown happened under Trump's watch in his first term. I fear that we are getting very, very close to that. Mr. President, Madam Speaker, that's my presentation. I know I covered a lot of information for the members across a number of topics. Happy to take any questions.
Thank you very much, Mr. Verghese. We appreciate the pace at which you went through. There was a lot of information, pretty stark and sobering. We do have DLS following this that will have specific Maryland numbers as well. In the meantime, let me see if there are any members who have any questions for Mr. Verghese. I see Delegate Lewis.
Thank you, Senate President Ferguson, and Matt, thank you for the presentation. I think it's safe to say this is dire and concerning. Given the delegation that we have, I would wonder if you have any feedback, particularly from the one member that is in the majority, and if they are helping in acknowledging some of the pain that we're going to see, across Maryland, but even to their own district. And if you can opine on anything there, if Mr. Harris or others are working to fight for Maryland in any way right now.
What I'll say about Mr. Harris is that, he is a very conservative member. He's the head of the Freedom Caucus, likely the most conservative faction in the House Republican Conference. But what I'll say about Mr. Harris is that there are moments where he agrees with the governor and the Democratic members of the delegation and is supporting us on some items. I can bring up the BRIC cancellation. This is the FEMA program that essentially was going to communities to make them more resilient. There was a project in Chrisfield in his own district, and we are working together to see whether we can get that money, $30 million, restored. He is working with us, for example, on the disaster declaration in Western Maryland. He joined the entire delegation to support the governor's request for a federal disaster declaration. And we all know that President Trump has really been critical of FEMA. He wants to abolish it and a slow walk disaster declarations for states like Missouri and Arkansas. He's working with us on our current negotiations with HHS on the Medicare waiver. So, Mr. Harris, I understand his political point of view, his values and what he cares about. He is pushing for more budget cuts in the reconciliation bill, but he is trying to be a partner on the issues sometimes that we find some common ground, and that's what we're trying to focus on.
Thank you, and thank you, Mr. President.
Thank you. Delegate Pippy.
Thank you, Mr. President. Appreciate that. And Mr. Verghese, thank you for the brevity in your presentation. And I apologize. Is that going to be provided to each member as an attachment somehow?
Yes, sir.
Okay, thank you. So my one question, or I guess my second question, is you had mentioned the potential impact related to our immigration policies. There was a figure on it. Was it 400 million? Was that the?
Yes, sir.
So my bigger question is, of all of the potential federal impacts that our state may face, how many of those are based on voluntary actions by the state? So, for example, policy decisions that this state has chosen to enact, and what percentage of the federal funds would be at risk for those self-inflicted decisions that we've made here in Maryland?
What I can say, what the Congress is trying to do is to push forward the president's priorities, which is to essentially say that undocumented families, even children, should get no health care, that anyone taking Medicaid or SNAP should be working. So they're pushing forward his priorities and his values and essentially penalizing states based on that. I don't have a full figure on what the total impact will be based on the state's current policies, but what you can see clearly is that they're trying to punish states, including states that have just expanded Medicaid, which includes both Republican and Democratic states, charging them differently in terms of that population, that there are a lot of coercive elements in this bill to either force states to change their policies or essentially penalize states that may decide to make decisions that the current administration disagrees with.
Okay. Yeah, if you could, and so I'll certainly take it offline, if you could just follow up with an itemization of how much potentially we would lose because of our own actions versus something that's, let's say, discretionary, like if the administration chooses to reduce NASA funding, that's certainly something that maybe we didn't do anything to deserve, so to speak. But I would be curious what percentage of all those figures that you just shared with us are based on our own actions, and that would be very helpful. Thank you.
Will do, sir.
All right. Senator Reedy.
Thank you, Mr. President. Matt, thank you for the presentation. I guess one main question and maybe a follow-up. You mentioned the overall tax package and the favoring the wealthy. What are the what's the tax relief for the wealthy in the bill? My understanding is there's no changes to the current tax rates in the bill.
Yes, so essentially the analysis that was done was when you make these tax cuts permanent, compared to the losses of the social welfare programs, both on SNAP and Medicaid, the analysis like the Urban Institute and other organizations have done is looking at the total impact on resources is slanted towards the top brackets. If you look at the CBO analysis as well as they look at income brackets as well, their analysis and that they're nonpartisan has also said who benefits the most in terms of total benefits going to them is also the higher income brackets. You know, that analysis is not mine. It's really just based on people's kind of understanding of where the money is flowing. We know this is a multi-trillion-dollar package. There's a cost to this bill to extend these tax cuts permanently, and that cost, who's benefiting from that cost, both the CBO as well as other organizations say is the top income brackets.
The new spending in the bill that the CBO scores, though, most of the quote unquote new spending is just because we're keeping the tax rates where they are now and not allowing a large tax increase to go up. So, of course, people who would pay more raw money are wealthier people. Let me ask you just one follow-up, and thank you, Mr. President, for the time. What is the impact of the SALT cap, assuming it stays there, the raising of the SALT cap? Is that going to be a positive for us in the state? You may have mentioned that in your presentation. I'm sorry if I missed it, but just if you could reiterate or explain that. Because I thought that was maybe a positive for us in the package from a dollars and cents standpoint.
Absolutely. Senator, I think it really depends on where the SALT language ends up. You know, the 40,000 was what was negotiated in the House with the SALT caucus in the Republican conference. The Senate is likely going to curtail that to some extent, whether it's a lower number or reducing who can apply for the SALT cap. I think the dynamic impact to Maryland will really depend on who itemizes their deductions as opposed to taking the higher standard deduction that's also in the law. I do think in the end, we are one of those states which will benefit, not as much as New York and California, but I think the analysis has said from the CBO that we will be a net positive on a higher SALT number.
All right. Madam Speaker, did you?
Delegate Pena-Melton.
Thank you, Madam Speaker. Great to see you. Good afternoon, Mr. President and colleagues. I want to ask the question of Mr. Matt Burgess. When the state makes decisions, it's usually because of what? For example, Medicaid. When we decided to do the expansion, right? When we decided to create the program, why is that?
Ma'am, I would say I think it was the decisions of the General Assembly, often in times in partnership with the governor, that we care about people being healthy, that healthy individuals, and I think we've all seen people who benefit from Maryland's Medicaid program right now. Healthy individuals are productive individuals. They lead better lives. They can pursue their full potential. And I think that's the reason why Congress, when they passed the Affordable Care Act, and why now a majority of states have decided to expand Medicaid and present those benefits to a wider range of people. I want to say that what is happening in this bill, I know the repeal of the Affordable Care Act was unsuccessful during the first Trump term. This, in many ways, the changes to Medicare, the changes to Medicaid, the impacts to the health exchanges are likely the biggest impacts to federal healthcare policy since the passage of the Affordable Care Act.
And if I may, Madam Speaker, thank you. So isn't it true that Medicaid eligibility in Maryland for adults, excluding those needing long-term care, right? And some of those are in nursing homes, right? And generally, they're tied to income limits based on the federal poverty level, correct? And in fact, in Maryland, For individuals, the income limit is typically 138% of the federal poverty level, which actually translates to $21,607, correct?
Yes, ma'am.
And that is not a lot of money. And in Maryland, we have 24 jurisdictions, correct?
Yes, ma'am.
And we have 1.5 million people on Medicaid, correct?
Yes, ma'am.
And in fact, every single jurisdiction is receiving Medicaid, right?
Yes, ma'am.
You have, for example, Allegheny County with 22,000 people. You have Cecil County with 25,000 people. You have Frederick County with 48,000 people. You have Hartford County with 51,000 people. You have Montgomery County with 209,000 people. Prince George's with 261,000 people. Washington County with 48,000 people. Wycomico County with 39,000 people. Worcester County with 13,000 people. So these are a lot of people they're living in poverty, correct?
Yes, ma'am.
And otherwise, if they don't have insurance, where do they end up?
The emergency room or
And
not
that
getting.
is the highest healthcare cost.
Yes.
Thank you. Thank you, Madam Speaker.
Senator Corey McRae.
Thank you, Madam Speaker, and it's always good to see you, colleagues, and Mr. President. Ms. Verghese, I had one question just to get a little bit of understanding with the overtime, the tax cuts and the overtime. Is this across the board, or is this just in industries with the restaurants?
So I think the way the provision is currently written, it gives a lot of leeway to the Treasury to define what industries will be included and not included. I think what the current Treasury Secretary has stated is that the definition will be expansive. But I think, sir, you should also note that the Senate has problems with that provision. They're trying to curtail it and make it more narrow. So I believe whatever we see coming out of the Senate is likely more going to become law. So we'll see exactly where that language ends up.
Has there been any suggestions about like the guidance? I know you said Treasury, what industries will be impacted with something like that?
I think if the House language is included, I think we will likely see a very broad definition of what is included. I think what they are also trying to be mindful of, to be honest, is a shifting of people's compensation packages into vehicles that are not taxed. So what portion is your regular pay versus what is your overtime pay? So I think the rulemaking around this is going to be really critical to see how it's actually implemented and who actually benefits at the end of the day.
Okay, I appreciate you and thank you again.
All right. Well, it looks like that does it for questions for Mr. Verghese. So on behalf of all of us, thank you, Mr. Verghese. Thank you for your ongoing coordination and discussion. We know there are a lot of twists and turns ahead as the bill potentially moves forward or not, passes the Senate or not, and then passes the House or not. So a lot of twists and turns. We look forward to hearing the updates moving forward and along the way. So thank you for your time today. We appreciate you.
Thank you, sir. Thank you, ma'am.
Thank you. All right. Our next order of business is a presentation from our Department of Legislative Services. We have several representatives who have joined us today, and I have a list of everyone. If you give me just a short moment here. We have with us David Romans, the Fiscal and Policy Analysis Coordinator. We have Tanya Zimmerman, the Operating Budget Manager, Ann Brom, Operating Budget Deputy Manager, and Elizabeth Allison, the Principal Policy Analyst. I believe, Mr. Romans, you have a presentation for us to begin. Is that correct?
Yes, Mr. President.
All right.
Hopefully
The
it's
microphone
on the
is yours.
screen. Hopefully
Yes.
you all see it. Great. All right, so we'll have a little bit of overlap with Mr. Verghese's presentation, but we'll try to go through it quickly and highlight things that are different or different topics. So the focus of our presentation is on the reconciliation bill and what this House has done and what is being reported is where the Senate is headed. We focus particularly on the SNAP program, the Medicaid program, and on revenues, as those seem to like the biggest kind of ongoing impacts that Maryland faces. A couple of caveats before we get into some of the numbers and details. One is, as you sort of heard, the Senate plan is very much in flux still. There were changes announced yesterday to some of the SNAP provisions. So we've given you our best effort on what we know at this point, but things are certainly going to change. And to the extent they have to compromise further to agree with the House, things will change further. So these are hardly the final numbers. They're very preliminary numbers. The other caveat I'd like to add is particularly in the Medicaid area, there's a number of things that are going to likely be up to interpretation by the Centers for Medicare and Medicaid Services, particularly around the provider taxes and some of the immigrant provisions. So in some cases, we aren't scoring any impact at this point because it would really depend on how they interpret things, whether there's a significant impact or very little impact from some of those provisions. So there's a lot of details it's going to take a while, even after the bill passes, to sort out quite how significant the impact will be. All of that being said, at a high level, we think based on the things that we can score and that seem more definitive in the plans, that the fiscal 26, state fiscal 26 impacts are not as horrible as we had worried about during session. And we think the SNAP and Medicaid changes will likely increase state costs by somewhere in the neighborhood of $100 million in fiscal 26. Part of the reason for that, as you'll hear when the other presenters talk, is that some of the provisions have delayed effective dates. So a lot of the things that are going to cause problems for states don't go into effect immediately. So there's a delay, and that's why it doesn't have much impact fiscal 26. The other area that the BRE will be looking at over the next couple of months is the SALT deduction cap. The state's revenue estimates in the end of session budget forecast all assumed that the president's tax cuts from when he took office would be extended. So that's already been built into our forecast. There was no assumption that the SALT amount would change. If it does, that may have some adverse impacts on our revenues in fiscal 26. I don't think it'll be a really large number, but it could definitely have an adverse impact. But the BRE will be doing a much more detailed scoring, so we have not put a number on that. The out-year impacts are much more significant in our view, and again, it depends on where the House and Senate end up. There are a couple of big areas of concern. The biggest is SNAP. Both the House and Senate are talking about shifting a portion of the administrative costs, a larger portion of administrative costs for SNAP to states, and they are also both proposing to shift benefit costs to the states. The potential risk for Maryland is up to $300 to $450 million on an annual basis once those shifts occur. It's very possible the administrative cost shift will happen immediately, which is in the $80 million range. The benefit costs do not happen until future fiscal years, so no immediate impact. But that's obviously long-term a potentially big impact. And I would note it's particularly concerning because when you go into a recession, the SNAP caseloads will go up. So it would put even more fiscal pressure on states, and Maryland in particular, when we have less revenue available to help pay for those rising costs. The second area that's of concern, but it's a little bit hard to definitively say where we'll end up, is Maryland has a Healthy Babies program, which provides Medicaid coverage to pregnant, undocumented immigrants. Currently, we get about $100 million in federal match for that program, which is clearly in jeopardy. And as was referenced in the earlier presentation, if the state were to choose, and it would be a state choice, to continue to provide that coverage, we would be subject to a penalty where we get a lower federal match on our ACA expansion population, which would cost us in the neighborhood of $250 million a year. That penalty would not kick in fiscal 26. So again, it's more of an out year problem. But between a potential loss of federal match and the potential for a penalty if we continue the program, it's close to a $400 million potential impact. One area that we actually might see some offsetting savings in Medicaid is there are work requirements, and the work requirements are likely to, and also more frequent eligibility determinations. And those two things are likely to reduce our ACA expansion population and produce some savings that may even offset the administrative costs of setting up work requirements, as Medicaid does not currently have any work requirements. And again, there could be some revenue impacts in the out years beyond the SALT deduction issue. There's a number of other tax provisions in the House and Senate plans. Maryland automatically decouples from most of those changes until the legislature has met and had an opportunity to opine, going forward. So it'll be up to the General Assembly to decide whether we want to go along with some of those other tax changes that will be described later on in the presentation. Last thing on this page I want to talk about is there's obviously also a direct impact on people in Maryland. National estimates suggest about 130,000 of our Medicaid expansion population, ACA expansion population, could lose coverage as a result of the work requirements and the more frequent eligibility redeterminations. That's more than a third of all of our current ACA expansion population. If we were to stop covering the Healthy Babies program, about 7,000 pregnant women would also lose Medicaid coverage. In the SNAP side, SNAP would also have more expansive work requirements. And again, depending on which version of the bill is adopted, anywhere from 150 to 180,000 people would be subject to the work requirements. They will not all necessarily fall off, because some of them will certainly comply. But again, that's the risk of people who might lose SNAP. I'm going to turn it over to Tanya Zimmerman, who's going to talk to you a little bit about the SNAP requirements in a little more detail.
Yeah, so the most significant impact on the SNAP program for the state is on the changes to the cost sharing requirement. The program has always been 100% federally funded for the SNAP program. The state does offer some state supplement programs, which are state funded, but the federal SNAP benefits have always been 100% federally funded. And the cost share for the administrative costs has been 50-50. The House and the Senate bill announced plan, the House passed bill and the Senate announced plans are slightly different in terms of the impact on the state. Both of them would have the impact beginning in federal fiscal 2028. In the House passed bill, all states would be responsible for a minimum of 5%. Higher cost shares would be applied based on the state's payment error rate being 6% or higher, which covers virtually all states, including Maryland. It would be 15% at 6 to 8%, 20%, 8 to 10, and 25% for 10% or higher. The Senate announced plan would not apply a cost share to all states at a base amount. It would just be based on the payment error rate. It does, the payment error rate of 6% would apply a cost share at this point to almost all states. And the cost share would be lower at 5, 10, and 15%. They did recently, just yesterday, announce a change in how that would be calculated. In the first year of implementation, the states would have a choice between their payment error rate in federal fiscal 2025 or 2026, but beginning in federal fiscal 2029, it would provide, it would be based on a 3-year average, which would provide a little more certainty, but would keep the payment error rate that would apply higher if you were in the process of working to bring it down. You go to the next slide. DLS is currently estimating that the benefit cost would be about $1.5 billion in federal fiscal 2028. So for each 5%, that would be about $75 million. The payment error rate was about 19% in federal fiscal 2023. So under the House plan, the state's responsibility would be about $375 million, about $225 million in the Senate announced plan if we stay above those levels. The department does believe the payment error rate will be coming down a little in 24, but they are not yet available. The House plan does make a change to how the payment error rate is calculated, which would have the impact of increasing the state payment error rates. So currently errors there's a tolerance level of $37 and 2014 dollars. It's adjusted each year for inflation, so it's actually a little bit higher currently. That would reduce it to 0. So any payment error you make under or over what the person would qualify would count towards the payment error rate. So this would increase the state's payment error rate. The Senate plan does not appear to include this change. Both the Senate and House plan change the administrative cost from 50 to 75%. The House bill makes the change immediately upon enactment. The Senate plan delays it to federal fiscal 2027, which would give the state a little time to adjust to that. Based on the fiscal 26 appropriation, DLS estimates that this would have about $83 million of additional costs for the state. So the work requirements under SNAP currently apply to able-bodied adults without dependents. They're limited to receiving benefits for 3 months in a 36-month period unless they're working for about 20 hours or more per week. Individuals are exempt if they're physically or mentally unfit to work, pregnant, caring for a dependent child, homeless, a veteran, or under a certain age and have aged out of foster care. But the state receives discretionary exemptions to relieve the requirements for 1 month per year. There are also waivers available at the Secretary's discretion. They're available based on an unemployment rate above 10%, or if there are not enough jobs. This can be interpreted in different ways or demonstrated in different ways. Currently, there are several jurisdictions in the state, including Baltimore City, that have the waivers, but it's 5 counties overall. It's Baltimore City, 3 counties on the Eastern Shore, and 3 municipalities. DHS reported that they closed about 26,000 cases between May 2024 and April 2025 due to the work requirements under current law. The House and the Senate plan make some similar changes, to the requirements. The House passed bill increases the upper age limit from 54 to 64. The Senate plan also makes this change. The House passed bill expands the requirements to parents for the first time, but exempts parents with children under the age of 7. The initially announced Senate plan change that slightly to parents with children 10 or over that would be subject to it. They have announced a revised text today that makes it 14 or older that it would apply to, which would align it with the proposals in Medicaid, and it would reduce the impact on recipients. They both limit the authority of the state secretary to issue waivers to areas with an unemployment rate over 10%, which would greatly reduce the number of jurisdictions that could receive it. Reduce discretionary exemptions. The Senate plan makes no changes to that. The Senate plan also removes existing exemptions for people who are homeless, veterans, or former foster youth. So for context, as of May 2025, there were about 668,000 individuals receiving SNAP. DHS reported under that increasing the upper age limit would subject an additional 66,700 recipients to it. Again, this would be likely lower because some people would receive exemptions or already being compliant. The expansion to parents under the House passed bill, DHS had reported up to 111,000 adult recipients would be impacted, but that would be a maximum number that they might receive exemptions. The Senate plan is in flux, and DHS is still determining the impact of it. No jurisdictions in Maryland would qualify for a waiver. There are some additional SNAP impacts. This presentation doesn't cover all of them, but another significant impact on recipients is a change related to energy assistance and how that is factored into the calculation for benefits for SNAP. Effectively, the changes that are being proposed would reduce the impact of receiving energy assistance on your SNAP benefit. This is likely to DHS reports this is likely to reduce the benefits for a significant portion of the SNAP population, as these benefits related to receiving energy assistance would be limited only to individuals with disabilities or who are elderly. And they also make changes to who can receive the benefits. It effectively would exclude refugees and asylees from receiving SNAP benefits going forward. Again, this is not an exhaustive list of the impacts, but I'll turn it over to Anne, who will cover the Medicaid provisions.
Thanks. So this first slide provides a brief overview of Medicaid. I'll just highlight here that the federal government generally pays for 50% of Medicaid spending in Maryland, but certain populations receive a higher match, such as spending on adults served in the ACA expansion group receive the 90% federal match. And this is important because it applies later to some provisions that impact federal reimbursement for certain services and providers. And so next slide. So moving to the actual Medicaid provisions, the reconciliation bill would establish work requirements for childless adults served under the ACA expansion. Certain groups like disabled adults and parents with dependent children would be exempted from the work requirements. And the Senate proposal adjusts the exemption to apply for parents with children ages 14 and under. Under the House bill, in terms of timing, this requirement would take effect no later than the end of calendar 2026. And under the Senate plan, states that demonstrate a good faith effort to comply with the work requirements could receive an extension to the end of calendar 2028. Next slide, please. Another provision increases the frequency of eligibility redeterminations. Currently, it's required to be once per year, and it would be sped up to be every 6 months for the ACA expansion adults. And that would start with October 2027 renewals. MDH estimated that the administrative cost to increase this redetermination would be about $22 million, although this would be more than offset by savings from resulting disenrollments, which I'll discuss on the next slide. And so combining work requirements and then increased redeterminations are both expected to cause approximately 130,000 Maryland adults to be disenrolled from Medicaid, and that's based on Kaiser Family Foundation analysis. That would be, as Dave mentioned earlier, that would be about 39% of the most recent enrollment count for ACA adults. And the annual savings from those disenrollments is projected to be $1.1 billion in total funds, and that includes $112 million in general funds. And so I'll just note here that there would be increased administrative costs that partially offsets that, but the disenrollments would cause a net savings to the state from these provisions. Next slide, please. I'll begin talking about provider taxes. And so those are used to generate revenue that covers some of the state matching requirement. Under the House bill, states would not be able to increase provider taxes or establish new ones as of the enactment of the bill. Under the Senate proposal, the cap on provider taxes would slowly be reduced by 0.5% of patient revenues each year until the cap decreases from the current 6% cap to 3.5% by federal fiscal year 2031. Some provider taxes, like nursing home assessments, would be excluded from the reduced cap under the Senate proposal. On the next slide, it just notes that Maryland currently collects assessments on hospitals, nursing homes, and managed care organizations. In fiscal 2026, hospital assessments will provide a combined total of $738 million. And MDH indicated that these hospital assessments would potentially not be reduced due to the Senate plan because those assessments could already fall under the gradually reduced caps. On the next slide, this discusses the projected impact of the provider tax changes. I'll skip to the second bullet that shows that there are two concerns that pose a risk to the implementation of the hospital assessments. The first is that Maryland collects the assessments through HSCRC's rate setting authority. And so this creates some uncertainty moving forward for how these policies would be applied and how CMS would evaluate Maryland's provider taxes. The second concern would be that under HSCRC's rate setting authority, some hospitals are excluded from the assessment, and that might need to change so that they begin paying the assessment to meet federal requirements for uniform and broad-based provider tax requirements. For other provider taxes on nursing homes and MCOs, there are a few technical changes that could require Maryland to also expand assessments to providers that are currently exempt for that same broad-based requirement. On the next slide, I'll begin discussing changes affecting immigrant coverage under Medicaid. One new provision in the Senate plan would change the definition of qualified immigrants that currently receive comprehensive Medicaid coverage. The overall impact would be removing the federal match for refugees and asylum seekers beginning October 1st, 2026. And so this change would either result in disenrollments among immigrants that are no longer qualified, or Maryland could continue coverage using all state funds. Although we do not yet have an estimate for how many Medicaid participants or how much federal funding would be affected by this provision. On the next slide, this discusses coverage of provisions affecting coverage of undocumented immigrants. There's a provision in both plans that apply a penalty for states that provide Medicaid coverage of undocumented immigrants using state funds. The penalty would reduce the enhanced federal match for the ACA adults from 90% to 80%. On the next slide, currently Maryland covers emergency medical services for undocumented immigrants, and then provides coverage for non-citizen pregnant women through the Healthy Babies program, as was mentioned earlier. The federal match for Healthy Babies could be at risk, and that would be about $104 million based on the fiscal 26 budget. Additionally, replacing those funds with state funds could trigger the 10% penalty to the ACA expansion match, and that would, as Dave mentioned earlier, that would be estimated to be about $250 million in reduced federal funding. On the next slide, I'll highlight here two other changes that would prohibit federal reimbursement for certain providers or services. The first is that both the House and Senate plan would prohibit federal matching funds for all services provided from certain abortion care providers. In Maryland, this would mainly affect Planned Parenthood, and MDH estimated that $2.5 million in state funds would be needed to replace the federal funding currently reimbursing those services. The second change would eliminate federal matching funds for certain gender-affirming care. Based on recent utilization of these services, MDH projected that $905,000 in state funds would be needed to replace the federal funding. And then on the final slide on the Medicaid provisions, this notes a few other changes, like reducing the timing for retroactive coverage when individuals first apply for Medicaid, and then authorizing expanded cost sharing. I'll note that there are other provisions affecting Medicaid in the two plans that I didn't cover here, and the details can change as the federal debate continues. But with that, I'll pass the presentation back to David Romans.
Yeah, so in the interest of time, I'm not going to go through these next two slides, but they'll be available to you all to peruse. What we tried to do is summarize the provisions that we think have a fiscal impact, showing for each the House and Senate the timing of what state fiscal year the provision would start impacting us and what the annualized fiscal impact would be, as well as the number of enrollees in the various entitlement programs. So it puts together kind of all the numbers that we've walked through. Again, in the interest of time, we've covered most of these topics already, but it just puts it all in one place for you. So the last section we want to talk about is the tax provisions, and I'm going to turn it over to Elizabeth Allison, who's going to talk to you about the details.
As Mr. Verghese already discussed, the House and Senate reconciliation bills contain a number of tax provisions affecting both individuals and businesses. The bills not only extend many expiring provisions of the Tax Cuts and Jobs Act of 2017, but include a number of additional provisions. The following slides highlight 6 provisions that may impact Maryland taxable income and thus Maryland income tax revenues. Note, however, that this is not an exhaustive list. First provision is the state and local tax deduction limitation, or the SALT cap, on the next slide. Tax Cuts and Jobs Act temporarily capped individual state and local tax deductions to $10,000 for tax years 2018 through 2025. The House and Senate reconciliation bills both permanently extend the SALT cap and limit the use of pass-through entity tax workarounds like Maryland's. However, there are some key differences. House reconciliation bill increases the SALT cap to $40,000 for tax year 2025 and phases out the enhanced limitation for taxpayers with modified adjusted gross income in excess of $500,000. The deduction limit and the income threshold are adjusted by 1% annually through 2033, after which they remain at those 2033 amounts. Senate bill permanently extends the existing $10,000 SALT cap, and Senate lawmakers have characterized this as a placeholder while discussions are ongoing. Senate bill also requires partnerships and S corporations to treat pass-through entity taxes as separately stated items and establishes an individual level limitation for the owner's share of those taxes. On the potential implications for Maryland income tax revenues, note that Maryland disallows deductions for state and local income taxes. The SALT deduction does limit the amount of state and local property taxes that an individual may deduct on their Maryland income tax return. But as Mr. Verghese discussed, the Maryland revenue effect of proposed federal action to increase the SALT cap largely lies in the extent to which it increases utilization of the itemized deduction method. Compared to DLS's end of session general fund forecast, the House version of this proposal may adversely affect Maryland income tax revenues. Next slide highlights two other individual income tax provisions that may impact Maryland income tax revenues in the near term, specifically the limitation on the tax benefit of itemized deductions and the deduction for car loan interest. With respect to the first, the Tax Cuts and Jobs Act temporarily suspended the PEAS limitation, which reduces allowable itemized deductions for certain high-income taxpayers. Under the current law, the PEAS limitation is reinstated after tax year 2025. Both the House and Senate bill permanently repeal the PEAS limitation and instead generally limit the tax benefit of itemized deductions to 35%. Because these provisions reduce otherwise allowable itemized deductions, they may positively affect Maryland revenues. With respect to car loan interest, both the House and Senate bills propose deductions of up to $10,000 for qualified passenger vehicle loan interest, which phase out for taxpayers with income in excess of specified thresholds. House version proposes a temporary above-the-line deduction for tax year 2025 through 2028, which may adversely affect Maryland income tax revenues for those years. The Senate version, based on the way it's drafted, is not expected to flow through to the Maryland return. Next two slides highlight three business tax provisions with the potential to adversely impact Maryland revenues in the near term. The House bill temporarily reinstates and the Senate bill permanently reinstates full expensing for domestic research and experimental expenditures beginning for tax year 2025. The Senate bill allows taxpayers that meet certain gross receipts tax test to elect to apply the provision retroactively to tax year 2022. Also note that in the Senate bill, this provision would be permanent for tax years after 2025. House and Senate bills also enhance the business interest limitation by modifying the definition of adjusted taxable income for purposes of this limitation to correspond with the financial accounting concept of earnings before interest, taxes, depreciation, and amortization. Under the House version, the change applies temporarily to tax years 2025 through 2029. Under the Senate version, the change is applied permanently for tax years after 2025. Lastly, the House and Senate bills propose similar depreciation allowances for certain qualified production property used in agricultural or chemical production. So finally, Maryland law provides for the temporary automatic decoupling from certain federal tax changes if the comptroller determines that the impact to state revenues meets a specified $5 million threshold. To put this in context of the House and Senate reconciliation bills, for an amendment to the Internal Revenue Code that is enacted in 2025, if the comptroller determines that the state revenue impact is at least $5 million for fiscal year 2026 or any preceding fiscal year, the state automatically decouples from that amendment for tax year 2025 and any preceding tax year. Otherwise, the General Assembly would need to pass legislation in order to decouple from such an amendment for future years.
Madam Speaker, Mr. President, that completes the DLS presentation. Happy to take any questions the committee has.
Well, thank you to each of you who presented. We very much appreciated the detailed numbers and impact. First hand I see raised is Chairman Barnes.
Thank you, Mr. President. Thanks, David, to you and your team for the great presentation. I just want to go back a little bit and refresh my memory and hopefully the committee's memory. Where did we land on rainy day fund when we left session? What was our rainy day balance?
Yeah, we have a little over almost $2.1 billion in the rainy day fund.
And our fund balance, where was that?
Over $300 million.
And our fiscal 27 structural, where are we structurally for fiscal 27?
Fiscal 27 structurally was about 155 million to the negative.
Okay. But considering our robust cash sort of that we have sitting there, it would seem that the state's in pretty healthy fiscal shape at this point with the actions that we took following the last legislative session. And I know this is really great, and I thank the presiding officers for doing this committee, because the danger and the concern is we see more write-downs like we saw in March, which were driven by the Trump administration. I think, what was it, David, about together with the December write-downs, they pointed to about $700 million of write-down.
That sounds correct. Yeah.
Yeah, just based on the Trump administration's action. So, I do think the state's in good fiscal shape, and we hope that all of the things that we've talked about with the reconciliation bill and the tax package, and frankly, something we'll probably get to at later meetings with federal workforce, don't come to fruition, because it would be a shame to upend all the great work this legislature and the governor did this last session. Thanks for your presentation.
Senator Phelps.
Thank you, Madam Speaker. Ann Braun, I just want to follow up. It's kind of on an issue that Chair Pena-Melnick started. Could you put on the slide a pretty massive potential implication of eligibility requirements on Medicaid, and it was like $1 billion through fiscal 29. Do you have the capacity to quantify, though? And I think Chair Pena-Melnick made the point that a lot of folks, if they're off the rolls, are going to go to ER rooms, uncompensated care built into hospital rates. Do you have the capacity to quantify that part of the equation? Because there, you have a number there, but there's got to be an offset to the costs under our system in Maryland. The uncompensated care amount that would skyrocket, I would think, would be a number that would be pretty interesting to analyze as far as, kind of giving it the full breadth. So, Ann, that was sort of your presentation. I don't know if that's beyond the scope of DLS's ability to do, or is it something you can ballpark?
I thank you for the question. Yeah, I would say that the $1.1 billion in total funds is savings to the state's budget, showing mostly federal funds, and 112 million in general funds. And so no, that wouldn't include any other costs like you're describing in that analysis. But yeah, that shows state budget savings. And I could try to look into that analysis and see.
Well, because we always talk about how, the uncompensated care amount, is borne by all Marylanders, and I got to think that you talked about some numbers that are pretty staggering here. So I just put it out there for a query, and maybe you could take a look at it. Thank you, Madam Speaker, Mr. President.
All right. Thank you, Mr. Chairman, Chairman Feldman. All right, we are now, it doesn't look like we have any further questions for our DLS analysts. Thank you all very much for your very, very excellent work detailing where things stand. Obviously, it is a moving target, and this is really helpful information as we start to analyze where we stand and where the final product will be. And certainly we will rely on your expertise a great deal as we navigate this. So thank each and every one of you for your excellent work. Next up, we are joined, I believe, by do we have our Attorney General, Anthony Brown, is here. He is also joined by Mr. Adam Kirshner, the Senior Assistant Attorney General for the Federal Accountability Unit in the Civil Division. And Mr. Attorney General, thank you again for your time today. We appreciate it. We want to make sure that we maximized it. So thank you for being here, and we look forward to your presentation.
Thank you very much, and good afternoon, Mr. President, Madam Speaker, members of the Joint Federal Action Oversight Committee. And so for the record, I'm Attorney General Anthony Brown, and I do appreciate this opportunity to update you on the critical work of our Federal Accountability Unit and our implementation of the Maryland Defense Act of 2017. Our mission is clear, and it's to protect the rights, privileges, and interests of our residents and defend the interests and sovereignty of our state within the federal system. First, I do want to express my sincere gratitude to the General Assembly for providing the resources necessary to establish and sustain our Federal Accountability Unit. Your investment has enabled us to pursue an aggressive litigation strategy within a broader coalition of 23 like-minded attorneys general, where we filed close to 30 actions in federal courts nationwide and have submitted numerous amicus briefs. I'd like to highlight 6 critical areas where our Federal Accountability Unit has been particularly active in defending Maryland. First, when the administration attempted to fire thousands of probationary federal employees, we led a 19-state coalition that initially secured court orders requiring the discontinuance of the unlawful terminations and the reinstatement of those employees. On appeal, only the discontinuance of the unlawful terminations was upheld. And while many employees had been reinstated, that portion of the order was stayed by the Fourth Circuit. The case continues in the district court in Maryland and on appeal. Second, we challenged the dismantling of AmeriCorps programs that have invested over $21 million annually in Maryland to nonprofits and community organizations. We secured a federal court order in early June requiring the restoration of AmeriCorps programs in Maryland and other plaintiff states, with the case continuing on the merits. Third, Maryland's universities and research institutions, as you know, depend perhaps more so than any other state on NIH grants that support groundbreaking medical research. They drive our innovation economy. So when the administration imposed arbitrary 15% caps on indirect costs, we joined 22 states in federal court to protect over $300 million in Maryland funding to the University of Maryland College Park, University of Maryland, Baltimore, and other higher education institutions, with a Massachusetts federal judge extending temporary blocks on those cuts. Fourth, the Trump administration rescinded all Department of Transportation orders, rules, funding agreements, and policies that reference climate change, greenhouse gas emissions, racial equity, environmental justice, or DEI goals. And that threatened hundreds of millions of dollars in transportation funding here in Maryland. So in response, we joined in action to protect that federal transportation funding streams, which support, as you know, the $21.2 billion transportation program. And we're protecting that against these federal conditions and restrictions that we claim are unlawful. In a separate action, Maryland led an amicus brief defending MBE and DBE programs that ensure minority and disadvantaged businesses have fair access to government contracting opportunities. Fifth, we filed an action to block the Department of Education's termination of over $600 million in K-12 teacher preparation pipeline grants. You know better than most that Maryland is facing a 16,000 teacher vacancy, 6,000 teachers operating with conditional licenses, and these federal programs are essential to addressing our education shortage, our educator shortage. Six, and finally, we filed amicus briefs defending federal firearms regulations, including the prohibition on force reset triggers that can convert semi-automatic weapons into machine guns. We are focused on preventing the return of these dangerous devices into our community, since Maryland law also prohibits them. So, members of the committee, while we've achieved significant early victories in many of these areas, and Adam certainly can highlight those and respond to any questions you have about the details, we have to be realistic about the challenges ahead. We're in this for the long haul, recognizing that the current and anticipated threats by the administration in Washington required a sustained vigilance and strategic litigation. The cases that I've described represent just a fraction of our work across dozens of federal policy areas affecting Maryland. Hundreds of lawsuits have been filed challenging President Trump's executive orders and administration actions, with courts blocking the administration in numerous cases. If I had to tally up the wins, losses, I'd say we've seen more wins or victories. But again, these are temporary, they're preliminary, and the cases are still being considered on the merits. So your continuing support in defense of Maryland's interests and supporting the Federal Accountability Unit is essential to our success. And again, I want to thank you for that support. And now I'm pleased to turn the presentation over to Adam Kirshner, who is the chief of our Federal Accountability Unit and brings extensive Department of Justice experience to our effort.
Thank you, Attorney General. I just wanted to add to what the Attorney General said about what our work is at the Federal Accountability Unit. We are working with our partners in the multi-state coalition and bringing numerous actions. And I would say that our actions, our work in the Federal Accountability Unit falls into three boxes. One box is the work that we are leading or co-leading, and the Attorney General highlighted several of those matters that we are leading or co-leading. The other one is where we are in a more supportive role, where we are putting together declarations and reviewing papers being led or co-led by our partners. And the third one is that there's matters that are coming up all the time with our clients on the work that's being done vis-a-vis the federal government, and whether these are matters that would lend themselves to litigation or to be prepared in anticipation of litigation in terms of addressing the relationship with the federal government. And so the work where we have led or co-led is a tapestry of the type of work that we have done. As the Attorney General identified several of them, there's the probationary employee case, there's the AmeriCorps case. Both of those were actions brought in the District of Maryland. Another NIH funding case is where we have been one of the co-leads, where numerous grants were terminated by NIH for disfavored topics, and a judge appointed in the early 1980s found that this was one of the was the most egregious examples of federal government discrimination that he has seen in his 40 years on the bench, and we secured an initial victory in that case. On the Department of Transportation funding, we are one of the co-leads where the federal government has added terms to the future grants related to immigration and other items, and that we brought an action with being a co-lead with California, and this goes to the important funding we have for the Department of Transportation and the transportation projects that the Attorney General highlighted. The Attorney General highlighted our amicus in the disadvantaged business enterprises case, and then on the forced reset triggers as well, where we brought an action here in the District of Maryland as one of the co-leads on that matter as well. And I think that those actions where we have led or co-led is a good indication and exemplars of the other matters that we have been heavily involved in. And I appreciate the time today.
Chair Corman.
Thank you, Madam Speaker. Mr. President, two quick lines of questions, if you'll indulge me. Mr. Attorney General, I've gotten many inquiries about different cases that the state has or hasn't joined, and your office is very responsive on particular ones, and explaining that you can't get into why you might have not joined the tariff case led by California or the zero emission vehicles case led by California. So I won't ask you to comment on the particular cases, but could you just talk a little bit about the process you all go through to decide whether or not you're going to join one of these cases, and then separately whether you're going to be leading, file an amicus brief? Who do you consult? Do you check with the governor? What the sort of process is? Not about any specific one, but just sort of the general process overall. Because obviously, as you know, there's tons of cases out there. So I'm just trying to understand how you make those decisions, because there are some notable ones where you're taking a different role.
And as you mentioned, and thank you for the question, Chairman, we look at things like standing. Can we articulate a harm to the state? And what the level of interest is. We look at working with our clients. Do we have the factual basis in these declarations that Adam mentioned, where we can put forth a real case on behalf of the state? One of the reasons why Maryland didn't participate in a lot of actions under my predecessor and Governor Hogan is he didn't allow our client, the AG's clients, our agency heads, to participate in preparing those declarations. And as we're seeing, if you're not participating in a case, in some cases like the AmeriCorps case, you don't benefit from the court's ruling. So we participate in that case. We're going to be able to benefit. We are benefiting from that ruling. You mentioned two cases, one the tariffs and the other having to do with the California standards, EPA standards. And I can tell you without going into detail that it was not a standing issue. It was not a harm to the state issue. There are other factors that we consider and that I'm not really comfortable in sharing in an open setting that cause us not to join those two cases. In both of those cases, we anticipate that relief will be nationwide, regardless of who the plaintiffs are in those cases. And the tariff case, while was successful in the trial court so far, and with a preliminary injunction, it may have been a TRO on appeal that has been stayed. And maybe Adam can fill us in on the status of the EPA standard case. I don't think there's been action there.
Yes, I believe that at that point, that case the complaint has been filed, but there has been no further action beyond the filing of the complaint by California and others.
So in brief follow-up to that, if the presiding officers will allow, before I get to my second line of questions, is you mentioned something really important and interesting, which is we probably 7 years ago now, 8 years ago, removed the limitation on your ability, the Attorney General's ability to file cases because you no longer require the governor's consent. But you pointed out that even not needing that formal consent, there can still be limitations because the prior governor was not cooperating with the litigation, even though the Attorney General was able to file it. So that does lead me to ask, do you check with the governor informally? I know you don't need his consent, but do you check with the governor's office before filing or joining these cases?
That requires the Office of the Attorney General to notify the governor in advance. There are some provisions, exceptions to that if things are moving too quickly. And in that case, there would be notification after a filing. But so there is that formal notification. And because we are engaging various agency clients that are reporting directly to the governor, we are in communication with the governor and his team.
Thank you. I'll start with my second line of questioning. Of course, the presiding officers will cut me off whenever they see fit, which is, about 7 years ago, the Joint Committee on Federal Relations, so not this committee, but a different joint committee, held a hearing regarding National Guard deployments under the prior Trump administration to the border. We're now dealing with maybe an even more serious, perhaps this is a controversial question, but I think really important issue, which is the potential for our state National Guard to be deployed internally in the state. And so I know the Attorney General has an Assistant Attorney General in each of the departments. I think that includes the military department. But I'm wondering how you've addressed the potential issue. I think it's 10 USC 12406 of calling the National Guard into sort of federal service within our state. The law requires the governor to be involved. I'm not sure that's what happened in California. So have you been dealing with that? Has your Assistant Attorney General been advising the military department and the governor on that? How is that going? Because it's something that could happen, very quickly without a lot of advance notice.
So the military department is one of our clients. Each of our clients is somewhat unique, and their uniqueness is that the TAG, the Adjutant General, has legal counsel provided by the Office of the Attorney General and also legal counsel provided by her military judge advocate general. And there is inherent tension in that relationship, not because of personalities and people, but the nature of that relationship. You have Title 10, as you reference, mobilizations and deployments of the Guard. You have Title 32. Some of them are presidential call-ups. Some of them are activations by the governor. Well, when we saw what was happening in California and California brought an action, Maryland joined an amicus in support of that action. The authority that the president used required consultation with, or some language to that effect. It didn't say approval. The position that California has taken is that it requires approval. We support that position. And because of what we're seeing in California, I can assure you that, we are prepared to take whatever actions we think are necessary and warranted if we saw something similar occurring in the state of Maryland.
Great. Thank you, Mr. Attorney General. I guess I'm just concerned that, we want to make sure our military leaders are going to be on the same page as that, but appreciate it. Thank you, Mr. President. Thank you, Madam Speaker.
All right. Thank you, Chair Corman. It does not appear that there are any further questions. Before letting you go, General Brown, I just want to personally thank you for you representing the state in the AmeriCorps case and the resultant impact it had. It was one in particular where it felt rather egregious that the rule of law was not necessarily being followed. The court has held that standard to be the case. And frankly, I feel sad for the estates that did not join the lawsuit, for those AmeriCorps members who were serving their communities and then no longer permitted to, and were cut just on a Friday afternoon. In Maryland, that was not the case. Of course, it's still pending, but I just want to personally thank you for your attention to that matter and focus in, and certainly it had a result to help make sure that folks were following the law. So thank you for your efforts, and thank you to your team for helping us to navigate this moment.
It's an honor. And again, thank you for the authorities, predated my tenure, 2017, the Maryland Defense Act. And thank you for the resources. We've got a really sharp team that Adam's leading, working with AAGs around the state, representing clients. Couldn't do it without your support. So thank you for that.
Thank you. All right. In closing, Madam Speaker, if there's nothing further, I think we have our general. Want to thank each and every one of the members for being a part of this. If you have had the same experience I have at community association meetings or at farmers markets or at kids events, there are innumerable questions from Marylanders who are unsure about what the world looks like moving forward. We made important decisions this past session to put us on stable footing, as stable as could be in the face of uncertainty. But of course, there are lots of enormous questions ahead for the state of Maryland. This is, of course, the summer and generally slower, but we want to make sure that we are monitoring the impact as we move forward. So the next convening of this body will be the week of July 21st. We will send out the date as soon as possible. Critical topics that will likely be incorporated, and of course, if things change moving forward, given the passage of a bill or otherwise, or the impact of tariffs or something unexpected, we certainly know that we want to dive more deeply into the impacts on healthcare, and certainly the impacts of immigration enforcement here in the state of Maryland are two specific areas that we are going to be taking a greater look into. Please, members, if there are thoughts or questions or things that you would like to see us receive presentations or additional information on, please do not hesitate to reach out, as I'm sure you will not. Madam Speaker, anything further before we adjourn?
Just very quickly, I'm looking forward to our work ahead, and thank you all for your time today. And just in case you weren't aware, and if you're in Annapolis, at 4 o'clock, there will be another storm. So if you're, if I don't know if you're aware, I saw that on my phone show up. They're expected at 4 p.m. Wind gusts up to 13 miles per hour. Just saying. Thank
Federal
you.
action and the weather. You never know these days. Excellent. Thank you, Madam Speaker. Thank you all. We will all be in touch. Stay safe.